Good morning. My name is Laurene and I am the current chair of the Civil Society Forum on Drugs. The CSFD is an expert group to the European Commission, gathering 45 NGOs across Europe and representing the diversity of fields and stances on the subject. We are here to provide a set of recommendations from the European perspective to strengthen the field of drugs treatment in the upcoming years. We want to thank the Vienna NGO Committee for giving us the chance to participate today. Our first recommendation is to promote the public health perspective. Drug dependency and other addictive disorders are a matter of public health, and drug dependency services should be considered essential public health care services. Ensuring the continuity of treatment services is particularly needed in times of COVID. Organizations that provide evidence-based treatment should be integrated into each country's healthcare system to improve the quality of services. Unfortunately, the reality is that treatment modalities such as therapeutic communities are sometimes marginalized and undervalued. This needs to change. Additionally, this public health perspective on drugs will help eliminate stigma, which constitutes one of the biggest obstacles for entering and adhering to treatment, particularly so among women. Our second recommendation is the need to assess the magnitude of the problem and provide sufficient resources. Public authorities should not only take into account the most problematic profile of users, but they also should widen the scope of treatment programs and include populations who are often forgotten. This should result in a higher funding at national level. Treatment programs are scarcely funded, and decision makers need to implement high-quality treatment services and to provide the funding required to operate them. Our third recommendation is the need to strengthen the continuity of care logic. The split between harm reduction services and drug treatment services stands in the way of offering effective care. Treatment is a continuum of methods and means, and abstinence can occupy different positions on this continuum. While harm reduction services endeavor to mitigate the risks that arise from drug use, detoxification and rehabilitation objectives are typically left out, and since drug treatment programs are often seen as only abstinence-oriented, they are not included in the World Health Organization's harm reduction package. Regarding opioid substitution treatment, we would like to emphasize that the use of illegal drug while in OST should never be a reason for excluding a client from the program. The medication dosage must never be adjusted as a reward or a punishment. We recommend to include the recovery perspective in national healthcare services to ensure greater effectiveness of care. Our recommendation number 4 is the need to take into account all profiles of people who use drugs. There is a clear need to advance in research, design and implementation of programs for profiles such as young people and their family, homeless people, aging population, chronic users, women, LGBTQI+ community, people with disabilities, migrants and refugees. Additionally, treatment programs should include an intersectional perspective as well as a gender perspective. All of this would require the professional teams to be trained. Our recommendation number 5 is ensuring treatment in prison settings. We support offering treatment as an appropriate alternative to imprisonment, and even more so in times of COVID, where prison overcrowding is a major problem. Based on the equivalence of care principle, countries should ensure that evidence-based treatment, including OSTs and other pharmaceutical treatments, are provided in prison settings. Currently, only 54 countries across the world provide OST for people in prison. Additionally, the continuity of care between the community and the prison upon admission and after release is key to ensuring the effectiveness of prison-based treatment program. Recommendation number 6 is to support the lessons learned from COVID. The field of treatment has been very innovative during the COVID crisis with the introduction of more flexibility in OST prescription and greater use of e-health options. We recommend to evaluate and monitor the impact of such changes on services and their clients and adapt the services according to the evidence. All in all, CSFD considers that treatment is not viewed as a priority in the international political agenda, and it should be. As noted by the ministerial declaration, treatment services are falling short of meeting expectations and needs. We know that research, innovation, funding and political will could prove decisive in improving and strengthening evidence-based treatment services. Therefore, treatment should definitely be on the political agenda. Thank you.